Good afternoon, everyone. This is your host, Dr. Oluyemisi Famuyiwa, with another episode of Fertile Talks. So today's episode, I'm going to focus on a little known entity called pharmacy benefit companies. And I want to discuss how they influence access to fertility treatments and what patients and providers need to know about them. All right, so we're going to dive into what these companies are. These organizations play a very pivotal role in the healthcare system, especially when it comes to accessing fertility treatments. So if you or someone you know is navigating fertility care, this episode is packed with essential information. So let's get started. The first part of this talk is to discuss what are pharmacy benefit companies. So PBCs, or pharmacy benefit managers, sometimes PBMs, they were initially established to really simplify the medication process and to reduce cost. But over time, their role has expanded. Now they hold a significant and considerable power over medication pricing, medication availability, and more importantly, medication accessibility, particularly for patients seeking fertility treatments. So these companies sit at the intersection of insurers, the insurance companies, the pharmaceutical manufacturers, the pharmacies dispensing the medications, and ultimately patients. Their decisions influence which drugs are covered under your insurance plans and how much you will pay and how accessible these medications are, especially when it comes to fertility treatments like IVF. So let's talk about the roles and functions of PBCs in healthcare. PBCs perform several key functions that directly impact healthcare access. Number one, negotiating drug prices. PBCs negotiate discounts and rebates with pharmaceutical companies, which can affect which medications make it to your insurance formulary, meaning which drugs are covered and which aren't. Number two, formulary management. They create and maintain drug formularies, essentially the list of medications that your insurance company will cover and at what level. So fertility medications often fall into the specialty drug category, which means higher co-payments or co-insurance for patients. Number three, claims processing. PBCs process the prescription claims and reimburse the pharmacies, so ultimately they impact how quickly you can receive your medications. Number four, mail order pharmacies. Many of the PBCs actually run their own mail order pharmacies, which can offer convenience, but often at the expense of pricing flexibility. Let's talk about how PBCs influence your treatment, fertility treatments. Fertility treatments are often very costly and not always covered by insurance. This is where the PBCs have very significant influence. Number one, cost management. PBCs negotiate the prices of your medications like gonadotropins used for ovarian stimulation such as Gonal-F, Follistim, Menopur. They also negotiate prices for medications like progesterone and letrozole or Clomid. However, the prices you pay really depends on whether a favorable price has been negotiated. Number two, formulary design. If a fertility drug is not covered on your PBC's formulary, you could end up paying out of pocket. This is a major concern for patients who need specific medications that might not be the cheapest option, but are the most effective for them. Number three, prior authorization and step therapy. PBCs often require prior authorization for fertility medications. This means a delay in starting treatment until the insurance company approves the medications. Some patients are even forced to try less effective medications first. This is a process called step therapy, which can be particularly detrimental when time is of essence. So in other words, they may make you try IUI or timed intercourse, even if you have one blocked tube, instead of going to something more appropriate, and especially when your antral follicle count and your ovarian reserve is low. Number four, specialty pharmacy network. The PBCs may require patients to use their specialty networks, so that limits access to competitive pricing from other sources that may not be in their network. So let's start. The next segment we're going to talk about is what are the challenges that patients face due to the influence of PBCs. All right. Number one, higher out-of-pocket costs. Even with insurance, fertility medications can be expensive. When certain medications aren't covered or are subject to higher coinsurance, patients can find themselves paying thousands of dollars. Number two, delayed treatment. Prior authorizations and step therapy requirements can delay the timely access to fertility medications, which is critical in time-sensitive fertility treatments. Number two, lack of transparency. Many patients and providers don't understand how PBCs operate or how they decide which medications to cover. This lack of transparency makes it harder for both the patients and fertility specialists to make informed decisions. Number four, impact on personalized medicine. Fertility treatments are highly individualized. Unfortunately, the PBC's formularies don't always reflect this, so this leads to patients receiving a sometimes less effective treatment that aren't necessarily tailored to their specific needs or requirements. Now let's focus on how do the PBCs impact physicians and clinics, because physicians are also impacted. All right. The thing is administrative burden. Sometimes they place such a significant administrative burden and paperwork on clinics, from obtaining prior authorizations to appealing denied claims. Fertility clinic staff can often spend hours and hours managing insurance issues for patients. Number two, restricted prescribing. PBCs may limit the medication that the fertility specialist can prescribe, even if they want to prescribe something else. And this is based on formulary restrictions. So this can hinder the ability to provide the most effective treatment for each patient's unique situation. So what are the potential solutions and future directions, right? Number one, I think there needs to be more advocacy for fertility coverage. We need to push for broader insurance coverage for fertility treatments. This would reduce reliance on PBCs and their control over medication costs, giving patients better access to the treatments they need. Number two, increased transparencies. PBCs should be more transparent about how they operate, from rebate applications to drug pricing, and this will help both patients and providers make more informed decisions. Number two, tailoring formularies for fertility care. PBCs should be encouraged to design formularies that reflect the specific needs for fertility patients. This means including a wider range of fertility medications and allowing flexibility in treatments. Number four, physicians and clinics should be able to form partnerships with other specialty pharmacies. This would offer better patient pricing and easier access to fertility medications. I for one, I'm hoping that Mr. Mark Coban is listening to this talk. If anyone knows how to reach him, send him a copy. I think I would be very interested in seeing his company. He has a pharmaceutical company manufacturing discounted medication. Please get into the fertility space, because patients are really hurting. So Mr. Coban, if you're listening to me, get into the fertility space. So what patients and providers need to know in conclusion? The pharmacy benefit companies have a significant impact on access to fertility treatment. While they can lower drug costs through negotiations, their practices can also result in delays, higher out-of-pocket costs, and limited access to fertility medications. So for those undergoing fertility treatments, these issues can make an already stressful process even more challenging. So it's crucial to advocate for better insurance coverage, transparency from PBCs, and formularies that reflect the personalized nature of fertility care. A patient-centered approach from these companies could make a world of difference in improving outcomes for fertility patients. So thank you for tuning in to today's episode of Fertile Talks. I hope you found this discussion insightful. I want you to join the discussion. Please send me your comments. I think there's more to talk about on this. And as always, stay informed and empowered in your fertility journey. Until next time, this is your host, Dr. Yemi Famuyiwa.